Hello masterminds, welcome back to class. Today we are going to talk about antipsychotic medications. We will talk about what they are, how they work, the types of antipsychotics we have, and then their side effects. Ladies and gentlemen, if you are ready, grab your pens and your notepads because class has started. Now, antipsychotic medications are medications that are used in the management of psychosis. So in effect, these medications are used in conditions such as schizophrenia, schizoaffective disorder, acute psychosis, bipolar disorder, and depressive disorders with psychotic features. Now onto the mechanism of action or how they work. Antipsychotics work by blocking the effect of the neurotransmitter dopamine. Now, before you understand how antipsychotics achieve their therapeutic effect by blocking dopamine, you need to understand what dopamine is. So I'm going to spend the next 1 to 2 minutes explaining dopamine, and then I'm going to link it back to the mechanism of action of antipsychotics. Dopamine, by the way, is a neurotransmitter that is present in the brain of all humans. It is involved in actions such as movement, attention, learning, emotions, and pleasure. But in psychopathology, a lot of studies have demonstrated that increased dopamine level causes psychotic symptoms. So the idea of the mechanism of action of antipsychotics is that by lowering the effect or the actions of dopamine, you will in turn reduce the psychotic symptoms that are demonstrated by individuals suffering from psychosis. Let me use a diagram to bring out this idea much better. These are two nerve cells that are lying next to each other. Let's call this nerve A and then this nerve B. Now, the gap between nerve A and nerve B is a synapse or a synaptic gap. Within this synaptic gap is a number of neurotransmitters such as dopamine, serotonin, and norepinephrine. And the function of these neurotransmitters is to relay nerve impulses from nerve A to nerve B. But since we are talking about dopamine, I'm going to limit the discussion only to dopamine. Let's assume that dopamine is represented by these blue boxes, and the number of dopamine or blue boxes in a normal synaptic gap is 3. Under normal circumstance, when a nerve impulse moving from nerve A towards nerve B gets to this synaptic gap, it is the function of the dopamine here to ferry the nerve impulse across onto nerve B to complete the neuroconduction. But in the case of a psychotic disorder or psychosis, the number of dopamine in the synaptic gap is increased such that it gives the individual psychotic symptoms such as hallucinations, delusions, and disorganized thinking and behavior. This is where antipsychotics come in to block the activity or to reduce the activity of the excess dopamine in the synaptic gap. So this is how they do it. On the surface of nerve B are what we call dopamine receptors. And these dopamine receptors function by helping the dopamine in the synaptic gap to move the nerve impulse from nerve A to nerve B. So antipsychotics work by blocking these dopamine receptors to reduce the effect of the excess dopamine in the synaptic gap, and that is how they reduce psychotic symptoms. Now, I understand that this diagram and then the physiology may be too intricate for some of you to understand, but the general idea is that antipsychotics work by reducing the activity of dopamine in the brain, primarily by blocking dopamine receptors. Now, let's move on to the types of antipsychotics. There are two main types of antipsychotics. We have first-generation antipsychotics, second-generation antipsychotics, and depending on what you read, there is a growing evidence to suggest the existence of a third category of antipsychotics called third-generation antipsychotics, but that will not be discussed in this video. First-generation antipsychotics are those antipsychotics that were produced in the 1950s following the synthesis of the first antipsychotic medication, that is chlorpromazine. Hence their name, first generation. Now, they are also called typical antipsychotics. That is because their primary mechanism of action is by blocking dopamine activity. Common examples of first-generation antipsychotics or typical antipsychotics are, of course, chlorpromazine, fluphenazine, zolpidem, flupentazole, pimozide, and haloperidol. Now let's move on to the second-generation antipsychotics. Second-generation antipsychotics are those antipsychotics that were produced several years after the first-generation antipsychotics were produced. The sources vary, but essentially, second-generation antipsychotics emerged in the 1980s, and they are called atypical antipsychotics. They are called atypical antipsychotics because they don't work in the way that a typical first-generation antipsychotic works. If you remember, we have already explained that first-generation antipsychotics work primarily by blocking dopamine activity in the brain, but for atypical antipsychotics, they work by blocking dopamine and then serotonin, hence their name, atypical antipsychotics. Again, I need to make this distinction before I go on any further. Please understand that the first-generation antipsychotic have stronger antidopaminergic activity than the second-generation antipsychotics. In other words, the first-generation antipsychotics block dopamine activity more aggressively than the second-generation antipsychotics. And the first-generation antipsychotics do not block serotonin. They block only dopamine. Some examples of second-generation antipsychotics are olanzapine, risperidone, and quetiapine. This leads us to the side effects of antipsychotics. There are a lot of side effects of antipsychotics, but generally, the side effects an antipsychotic produce depends on what class it belongs to, whether it belongs to the first-generation class or the second-generation class. Most antipsychotics, regardless of it being first-generation or second-generation, have the following side effects: dizziness, drowsiness, dry mouth, fatigue, menstrual irregularities, sexual dysfunction, orthostatic hypotension, and seizures. However, between the first and then the second generation antipsychotics, there is a cluster of side effects that are collectively called extrapyramidal side effects or EPSE. These side effects are mostly caused by the first generation antipsychotics, although some second generation antipsychotics such as risperidone is known to cause EPSEs. Now, I'm not too sure if I want to discuss EPSEs into much details in this lecture video because it is also a broad area of discussion. But for now, understand that EPSEs are a cluster of movement disorders that are attributable to the use of first-generation antipsychotics. Some examples of EPSEs are akathisia, that is restlessness. We also have dystonia, which is typically muscle rigidity in the neck and back muscles. We also have tardive dyskinesia, which are late onset movement disorders that affect the orofacial muscles. And finally, we have Parkinsonism, which is almost like antipsychotic-induced Parkinson disorder. There is also another kind of side effect that is mostly associated with first-generation antipsychotics called neuroleptic malignant syndrome, or NMS. NMS is also another broad area of discussion, but for now, understand that it's a serious and life-threatening side effect of mostly first-generation antipsychotics that causes a lot of autonomic symptoms such as high-grade fever, unstable vital signs, and fluctuating level of consciousness. For the second-generation antipsychotics, because of their mechanism of action, they typically cause a range of metabolic side effects such as weight changes, increased blood sugar, and increased cholesterol levels. They are also notoriously known for causing serotonin syndrome and sedation. This brings us to the end of today's lecture video. Please like, subscribe, and share with others who will benefit from this. If anything was unclear, please drop a comment and I'll do my best to respond to this. Until next time, this is Masterminds Nelson. Ladies and gentlemen, class has ended.